Pregnancy is an exciting time, but it can also be a nerve-wrecking, anxious period. The COVID-19 pandemic is making it even scarier. Not much is known about mother-to-child transmission of the virus. So to discuss that and other risks to pregnant women, we're joined by Priya Sompile from the South African Society of Obstetricians and Gynecology. And she's talking to us from Pretoria. Very good morning to you. Tell us first what the effect is on the fetus and the newborn.
Good morning, Jane, and good morning to your listeners. Thank you for having me. Currently, there is no evidence of an increased risk of miscarriage or intrauterine infection. No vertical transmission has been documented, and the virus has not been identified in amniotic fluid or cord blood. So it's unlikely that, or we don't think that the infection is going to be associated with any congenital abnormalities. There have been a few case reports of documented preterm birth, but at this stage it's uncertain whether the preterm birth can be attributed to the viral infection or due to other causes.
Okay, well that's good news, isn't it? That if you're pregnant, you are not risking your child at the moment. But what can mothers do to reduce the risk of contracting the infection?
So, just as in the non-pregnant state, women should, social distancing should be practiced, hygienic principles, regular washing of hands, wearing of masks should be practiced at all times. And then if women do feel that they have any symptoms, they should isolate themselves from others, wear masks, and then contact their health practitioner or the coronavirus hotline to determine whether they should be tested or not.
Okay, and what about getting a caesarean? I mean, does that limit any sort of risk? Does it help in any way?
So no vertical transmission has been documented as yet. And like I said, the virus has not been identified in cord blood or in amniotic fluid. So at this stage, a caesarean section, from the data that we have, a caesarean section will not be protective. And a Caesar is only indicated for obstetric indications for now.
Okay. Breastfeeding, is it safe?
Yes. If a mother, and again, the virus has not been identified in breast milk, if the mother and baby are both well, breastfeeding, bonding, early skin-to-skin contact has several advantages. And we recommend that these women continue breastfeeding on condition they practice good hygienic principles, and again, hand washing before breastfeeding, cleaning the breast before and after breastfeeding, and that is what the DOH is currently advocating.
And I guess because we have no idea how long this is all going to take, I mean, should women plan pregnancies during the coronavirus epidemic?
That is a good question. The Department of Health is currently recommending that women consider delaying or postponing the pregnancy to after the pandemic. This can be difficult, particularly for women with infertility problems, and if they have a decreased ovarian reserve, where delay in pregnancy may result in a difficulty in falling pregnant. So at this stage, one should individualize the situation and discuss this with your doctor. But for young, low-risk women, the advice for now is that women postpone pregnancy to after the pandemic.
Good advice. Thanks for passing it on, Priya Sompile.